This structure you are seeing here is the inside of your eyeball, and these labels are the parts of your eyeball. Among these parts, there are four most important parts of the eye. They are the lens, the retina, the optic nerve, and the cornea. These four parts are most important parts of the eye. But among these four parts, I will talk about two that are very vital, and they are the lens and the retina. If anything happens to the lens of your eye or happens to the retina of your eye, or more, you are blind. So proper care should be given to the lens of your eye and to the retina of your eye. What is the function of the lens of your eye? The lens of your eye is what focuses the ray of light from an object that you are viewing to the retina of your eye, so that the image can form at the retina of your eye. We are able to see because of light. Without light, no one can see. That is why you can't see an object in darkness. You can only see an object when there is a light. Because once there is light, every object reflects that light that is being shown on it. So you are able to see because of light. So the lens of your eye is what collects the light and focuses the ray of that light to the retina of your eye, so that image, that object you are viewing, will be formed at the retina of your eye. Now, once the lens of your eye is faulty or is bad, it will be difficult for the ray of light from an object to focus at the retina of your eye. Therefore, the image of that object cannot be formed in your eye, which means you can't see. Now, there are things which, when you do to the lens of your eye, the lens of your eye will be faulty. And also, there are things that when they happen to the retina of your eye, the retina of your eye will be faulty. Now, another way to care for your eye is by eating food that are rich in vitamin A. Eating food that are rich in vitamin A, because the vitamin A helps the photoreceptors in your retina to work properly. Vitamin A helps to sharpen the photoreceptors in your retina and make them to be able to form a clear image of any object you are viewing. So when you eat food rich in vitamin A, examples of food that are rich in vitamin A are: mango is a fruit that is rich in vitamin A. Pawpaw is rich in vitamin A. Carrot is rich in vitamin A. There are many fruits that are rich in vitamin A. Another thing that helps the retina of your eye and the lens of your eye is the omega-3 fatty acids. The omega-3 fatty acid helps your eye to be in good condition. It also prevents glaucoma. Glaucoma is an eye defect that makes you not to see properly. It also prevents age-related eye problem. Now the question is, how can you get the omega-3 fatty acids? You can get the omega-3 fatty acid by eating mackerel, fish. You can get omega-3 fatty acid from fish oil, by eating mackerel, by eating salmon, or by eating walnuts. You can also get omega-3 fatty acid by eating soya beans. So the lens is what focuses the ray of light from an object you are viewing to the retina of your eye, and the image of that object you are viewing is formed at the retina of your eye. Now, the brain needs to interpret that image you are seeing so that you will understand what you are seeing, because without the brain interpreting the image, you will never understand what you are seeing. Even if you are reading, for example, you are reading and you view the number 4. When that number 4 is formed at the retina of your eye, your brain needs to interpret to you that what is formed at the retina of your eye is the number 4. Without the brain interpreting it to you, you won't be able to recognize what you are seeing. Now, what helps the brain to interpret that? What sends the image that is formed at the retina of your eye to the brain? What sends that image is the optic nerve. Optic nerve transfer that image to electrical signals, and they are transported as electrical impulses to your brain. So your brain now interprets that image at the retina to you, so that you will understand what you are viewing. That is why you should not do anything that will affect negatively the lens of your eye or the retina of your eye. For example, drinking too much alcohol affects the lens of your eye. It also affects the retina of your eye. Smoking, or allowing smoke fumes to enter your eye affects the lens of your eye and also affect the retina of your eye. So great precaution should be taken in order not to affect these two important parts of your eye, the lens and the retina, because once any of them is affected, blindness is near.